yɛkɔ health ministry ni mu nso a lot is happening abusua na obe sorry ni say hospital bed ni hospital nurses phone so complain it say the complaints are free the health ministry eba no also ye papa a lot from the human resource to equipment ni ade nyina but me no ka say yera kwabena minta candle the health minister waba breaki news be ama akose a misreaction on the internet me no ka say which screens ni so say government is considering reducing admission into health training institutions to tackle employment backlog into a tremwa say aban no omo wo me kan say pobomu ai say baby edro no obahu se nurses for bebre eni adwumaye e wo krodwe mu ha ene mewie be 5 years ago and I imposti me wie 10 years ago and you imposti me any ade ni nyina ekọ say it looks like omuhu ni say the admission a wo de ma enkrofo ma wo kọ the training institution for the nursing school no omo ya adoso nti say wo mo pese wo mo teso nti senke bia every academic term and as academic term you mefa nkrofo no wo mo fa be 300 as so mbete so akobe bia 200 bia na 150 bi any adade na the enti asemwe abe issues no abusuan eyensem bebre but then before we delve into why this has become a topic for conversation and a topic for deliberation no yenkotie said the minister honorable Minta Akando breaking sad news way about the reduction in admissions at the training institutions yeba yebeto aso.
The free primary health care policy is limited to all Ghanaians at the CHIPS compounds and health centers. The policy is currently being piloted in 150 districts with plans for nationwide expansion in the future. The beneficiary districts in the Volta region include Agoti-Meziopi, Angologan, Akachi North, North Town, and South Dine. The health minister, Kwabena Minta Akando, handed over medical equipment, tricycles and bicycles for distribution across the beneficiary districts. The Volta Regional Minister, James Gunu, called for collective efforts to ensure the success of the policy.
Through the implementation of primary healthcare strategies, we seek to improve health outcomes, reduce inequalities in access to healthcare services, and move steadily towards the attainment of universal health coverage. The successful implementation of primary healthcare requires a whole of societal approach. It calls for shared responsibility, strong partnership, and active community involvement. Together, we can build a healthier Volta region where every citizen has the opportunity to lead a productive and fulfilling life.
Mr. Akando alluded to measures under consideration by the government to address employment backlogs within the health sector.
We must begin to analyze our admissions into our nursing training colleges. What's the point if we are training more and we cannot recruit them? Because on average, we are admitting 34 to 35,000 students every year. But the rate at which we absorb them is not commensurate to the admissions. So government is reviewing that. But it's up to all of us whether to continue on that tangent or to drop that quota and invest in recruitment and recruit more people. This is for all of us to contemplate.
Fred Kwame Asari, Joy News. Oh.
Abusianfo, that is Yera Minta Akando and 18 Sema with the tuja and utie mu anati so hu say no I say employment no abeye issue and admission no ekosoro enti say ye behwe na ye bibia fa ho dia why not do more of employment na yentete admissions no so until say be hu say enipa dodo na wɔn da so tete fie a yɛn posti wɔn ne ade no wɔn anya adwuma yɛ ama ehu sɛ there is not much of backlogs and unemployed nurses at home na afei de yɛahwɛ baabi a ɛbɛka no wɔkyɛm sɛ aban eda so edwene hu susu hu kwan ya mbetimi afa so ayesa and in all no ni nyina ejina yenye so Ghana for so say yebehwe se yebeji atumu ana yenyi ntum but aban de neni ekire san kwan no eso now medical boss so say ensem we ya the honorable health minister Edebetu Jano raising a lot of conversations were internet and so this is because during the administration of the NPP under President former Nana Dankwa Akufo-Addo ni administration no something like this ebeto honoma na omo kase omo reduce the quota of the number of students omo be admit omo the various health institutions no a whole lot of issues from the camp of the opposition then NDC amomo chemu say debi ne nipa bakwa wodi mu akotene kasa ye ewo ho no Raminta Kando wo kasa ya chemu say debi it is a wrong it's not a viable decision say NPP then in government ne be decide say we more reduce the quota of the number of admissions that we taking in the various health institutions no enti ebe dia that means this is showing that the NPP is incapable right now. Do we say that NDC funds will almost incapable now let's give a quick flashback of the minister now for health Honorable Minta Kando what this and same way etoja ye buy beto so
Baya, one say school be to say bia naregu mutimi fa nipa be 1,000 and I John Dramani mam say there be your mam quota if you na kwen e be kire mu de wo so mofa nti if you na kono mam fa 1,000 bi mum fa 300 sa school we ye John Dramani Mahama breso a so mum fa 50 no na ko metima fa be 300 yes. Yes,
so they have deprived 250 people an opportunity
of 50.
Wow.
Now, national assistant clinical on some 500. Now,
Matthias here. I thought that what one will be a friend. Honorable, migrate your parents or more family.
They be a deprived amount for the brain.
A lot of people.
Yes.
Into what if you not say one year quite uncle nursing institution and so what good grades are.
Yes.
Can you say about me any and I don't.
As a channel no. You were John Mahama Breso or say institution no ebe intake per the capacity of the institution. The institution na ho dey betimi bia no wono mfa.
A few moments later.
We must begin to analyze our admissions into our nursing training colleges. What's the point if we are training more and we cannot recruit them? Because on average, we are admitting 34 to 35,000 students every year. But the rate at which we absorb them is not commensurate to the admissions. So government is reviewing that. But it's up to all of us whether to continue on that tangent or to drop that quota and invest in recruitment and recruit more people. This is for all of us to contemplate.
Abusia, the honorable health minister Ninsema Wakanye previously no na chese utimu se oye blame game blame me the former vice president Dr. Mahmoud Bawumia say you be hearing complaints now betting say obi say wato forms when you are good grades or apply it to this particular nursing college ya mfano ni ade nyina sa na kukuamu no omo down kate the number of admissions a omo eno na aba ne sa but say NDC ba they are going to do more training. But today, na se mo a all can say ye training ni wie na se oba na se we anya adwuma anya e na obeka. So I been with them say is it that the NDCs were trying to play mind game with Ghana for say be ya nurses for be botchi mbebunu be botchi akoto amo because when him so akoto ma NDC at the end of the day no or turn nursing forms a obenya admission okoso no nya admission ala waso beba fine any other day until you say something that they were preaching against no and the health minister is back again trying to tell us they are considering that decision. And no, and a man come no adults pa wo internet ni so and here again the same person who is now the health minister, but then no health minister, Yeraminta Kando, came out again to make some promises. Say womoba the NDC government through their head, which is President John Dramani Mahama, no, they have a lot of initiatives. Health institutions, those that want to go into the health institutions, health facilities, and it looks like they are failing. And Ghanaians have started bringing out videos like this to remind health minister. Said there was a timer. Oka ensembi say yentie ensemwe so embra
so oba afibia se na oho no ye no se ye wie school a health professionals ni wie school a obefa wonom amomanya adwuma aye inti obi a opese ko nursing training de ene e wo se wo ye 24-hour campaign ma aban we 24 hours ni kan say wo da, because what it means is that anyone so betwa.
A few moments later.
You may apply.
Okay.
Application no, and by force. That's also when you da.
People are calling out the health minister based on Ninsema Wakadada. And this is say they all can not say two different stories. And Kabeka se boshe na osheyen abemba we de boshe no osheyen enya ambemu ama mebunu bebre no. Looks like right now they are disappointed in the NDC government as well as Yeraminta Kando, because obi aka say we school ebenya adwuma ye na fe o se pa we shouldn't apply. What is really happening? Amafo Chema, there should be a vivid explanation from the ministry, the president himself, to address this particular issue. And yes, idea and yadu mbitimi atiasia. Now let's move on to